President Trump laying out big plans this morning as he met with business leaders at the White House. Speaking to reporters, the president promised, quote, some pleasant surprises on NAFTA. He also said that we'd see an end to Dodd-Frank regulations for the big banks and a major tax cut. Although we still don't have this timetable for when he would reveal his tax proposal. Just moments ago, White House Press Secretary Sean Spicer responded to a question from our own Blake Berman and said that the administration's feeling positive it can get health care done as well. Listen.
Let's not get ahead of where that review goes. It was an unfortunate incident. Clearly, when you watch the video, it is troubling to see how that was handled. But I'm not going to. They have clearly stated their desire to review the situation. Law enforcement's reviewing it, and I think for us to start to get in front of what should be a very simple, a local matter, not necessarily needing a federal response.
Sean Spicer commenting on the United Airlines drama. But of course, as we wait and see what the president will do, can he get Republicans in Congress full throttle behind his ambitious agenda? Diane Black of Tennessee is the chairman of the House Budget Committee. She joins us in a Fox Business exclusive. Welcome, Representative. Thank you for being here.
You're very welcome. Thank you for having me.
Of course, we've heard reports that range from it's on track to Sean Spicer's yesterday comment, I hope by this time next year, to back to the drawing board on tax reform. Which one of those three is correct?
We're going to do tax reform. We're committed to it. In the House, we've been working on tax reform since I got there almost 6.5 years ago. We are committed to making this code much more easy to understand and also to make it flatter and simpler. And so we're committed to it. I know that the Senate has been committed to it. They're working, as well as the president, campaigned on this, and we're going to get this done this year.
Okay, you say this year. Can I push you a little bit further? Treasury Secretary Stephen Mnuchin had said to our Neil Cavoto, not just next year, but by August. And I ask a lot of representatives this. Would you all be willing, or at least some of you, to forego your August recess if you're close on tax reform?
I think that we're so committed that we're going to work on this and get everything done that we possibly can by August. I'm really very hopeful that that will be the case. But here's what I want. I want to be sure that we get this right. Now, this is very important. It's a once-in-a-generation opportunity, and we want to be sure that we're listening to everyone from the small businesses to the large businesses, and for me, most importantly, my constituency, my individual constituency. And so we want to be able to get it right. Timelines are one thing, but getting it right is another, and that's what our intent is to do, is to get it right.
Well, we didn't seem to be able to see Congress get it right the first time on health care, although you voted for the Renew bill to repeal and replace, and you tried to be part of the solution versus part of the problem. All we have to go on, though, is that your own party, members of the Republican Party, dug their heels in and said, we don't like it this way. Where now does that stand, and how do you get them on board?
Well, I can tell you we're very close, and this is a matter of just sitting at the table with people that have differing opinions and making sure that we get to the best solution that will help the people of the United States. Look, we hear this every day in my state of Tennessee, and particularly in my district, that people are just suffering. The premiums continue to go up. The co-pays and the deductibles are what really are killing people.
Let me jump in here.
We've got to do it.
You know this industry and this business, and we're a business network, but you're a registered nurse, so you're on the Republican Doctors Caucus as well. Don't you at some points look at the insurers whose stocks have gone up, and we can show these multiple percentage points before Obamacare, after Obamacare, and now with the prospect of a changed bill? At what point are the insurers really on the hook?
I think the insurers also have an opportunity here to show that they can help to solve this problem as well with these increased premiums and so on. And so it is a very complicated situation because, as you have already indicated, there are a lot of players at the table. There are providers, there are insurers, there are the patients who, as you have already indicated as a nurse, that's who I'm really thinking of. I'm thinking about the individual who wants to have health care and wants to get the best they can get. But it shouldn't be a government top up, down. And that's the reason why I'm out listening, and I'm making sure that I understand what the people that I represent really can afford and what they want and what they desire. It should be patient-centered.
Well,
and that's where we really need to get.
Well, bravo to you, because I know you've had some tough town halls where people were very anxious, but you're continuing to face them, I hope. One quick question. If we see what happened with the health care plan, and then we're waiting on tax reform, and now people are wondering about infrastructure, Jeff Sessions was, of course, the Attorney General on the scene in Arizona today by the wall saying, we're going to make this a very secure border. That takes money. You're on the Budget Committee. Some say up to $20 billion. Do we have the money for that without blowing up the deficit?
Well, all that money is not going to be able to come from the federal government. It's going to have to come from other sources, such as the private sector. We still have not received a plan from the president. We did get his skinny budget, but we haven't gotten anything more than that. We're waiting for his mandatory budget. And we're also waiting for his plans on the infrastructure. Obviously, those dollars are going to have to come from other places besides just the federal government, and won't be able to be done all at one time.
Yeah, I fear that these things will go into 2018, but we shall see. Representative Black, thank you for joining us.
Well, you're very welcome. Thank you for having me.
Of course.